Hello, I am Kathy Orr, Director of Mission Services. Mission Leadership and Formation, Cohort 4, was given the task to go out and serve in the community. This was their mission assignment, to serve the poor and the vulnerable in our community. And then they were to report back to the group. Sister Suzanne Hartung, Chief Mission Integration Officer, states, all Providence leaders are committed to sustaining and building upon the Catholic heritage received from the sisters, fulfilling our mission and integrating our core values. Going into the future, Providence Health and Services must assure that its leaders are invested in, care deeply about, and are appropriately formed to promote and sustain its healing mission in ways that are consistent with the organization's Catholic identity. Cohort 4 decided to do this as a group effort. On September 14th, they participated in a health fair put on by the Providence St. Mary Medical Center and Walla Walla Catholic parishes. The health fair was for our community, especially our Hispanic community. Here is their story.
I was thrilled to be a part of the health fair this year. It seemed to me to be a huge success. Hundreds of people attended and took advantage of the free medical screenings, the useful information from many care agencies throughout the community, and of course the prize giveaways. Not being a medical clinician, I worked with the logistics team, setting up canopies, hauling in tables and chairs, maintaining the area, and then tearing it all down at the end of the day. I had the privilege of announcing the prize winners, and it was a joy to witness their happiness, especially the man who walked away with the brand new 47-inch television. I believe that this event would have made Mother Emily Gamlin proud. This segment of the Walla Walla community truly represents the poor and the vulnerable, the very ones that Emily Gamlin sought out and helped. These people waited in the hot sun for the opportunity to have their blood pressure measured, their cholesterol checked, and their glucose levels monitored, many for the first time in their lives. I was proud to be a part of the Providence St. Mary Medical Center volunteers that pulled the resources together and made such a difference in the lives of so many.
My name is Linda Helly. I helped out with the community health fair that St. Mary's was a part of. St. Mary's booths included information on stroke education, diabetes education, cholesterol testing, blood pressure testing, and some other things. I enjoyed helping the people get to the different booths. With the community partners, there was a passport where people could get a little sticker from each of the booths that were participating, and so I helped direct them to those booths. There was a lot of information that people could get that they wouldn't necessarily just go out and get themselves. So in that way, that's how we were helping the poor and the vulnerable get information, and even the blood sugar testing and blood pressure testing that they wouldn't necessarily just go get themselves. The part that I helped with was helping people understand the stroke symptoms and the FAST acronym. So facial weakness, arm or leg weakness, speech impediment, and T for time, call 911 as soon as possible.
Our mission statement, know me, care for me, ease my way. It means a lot, and yet it could become something that's not of substance. It could be just kind of a slick motto, cliche. But what we did on last Sunday, having a health fair, our mission formation group participating in that, took on something more than that for me. Over the years, my father-in-laws told my husband and I and our children that things are more real that we don't see than the things that we do see. And I thought about that as I watched people come through. Oh, we made real physical contact. We did some neat things. We educated them on asthma, diabetes. We shared with them their glucose and cholesterol numbers, and some of them never had that before. We taught mamas how to swaddle their babies safely so they didn't have to experience the tragedy of SIDS. We saved some lives that day. We made a physical connection. But when I think about the unseen connection, on a spiritual and emotional level, we made those connections that day. We were able to share part of ourselves beyond just the physical, beyond just going through the motions of a project, but we actually made connections with people on another level that I think has a greater impact. And it just shows them that we care about them as individuals and that Providence cares about their well-being.
My name is Laura Goodwin, and my role at the health fair was helping set up in the morning the tables and the pamphlets and getting it all ready for the people who were coming. One part for me that was good was seeing there was a father. He was sitting down getting his cholesterol tested, and he was just waiting, and his child was sitting patiently on his lap. And it just hit me that, you know, some people can't afford to get these simple tests that people take for granted, and having that there, people were very appreciative, and the line was actually really long for those services, and able to provide information to help people become healthier was really impactful for me. And providing a pamphlet that had phone numbers of different places in the community that you can go for help for food, shelter, mental health services. I thought that was really important, and I didn't realize we had something like that. So it was important for me, because I had somebody ask me recently, like, where do I get help for rent? If I would have knew about that pamphlet, and now I could take it back to that person and say, here are some resources for you to be able to in the future if you need them.
I experienced the community health fair that we had here at Providence St. Mary's Medical Center, and it was great working with the community and bringing everybody together, other people, involving them in the community to help out at the fair. One thing with the health fair, it was for me to be the change that I want to be in the community, and it just kind of renewed my spirit to be, you know, do more for the organization so that we would involve the community. There was lots of people that showed up, a lot more than I thought, to get the tests, and helping bring our community closer together. I just think it was one of those things that we need to do more often.
I love to volunteer. I've done it many times. It's a wonderful thing. Part of this, we did a volunteer thing across the street to help people be aware of their healthcare risks through blood pressure and cholesterol screening. I did blood pressures, helped people be aware of where the highs and lows were of their blood pressure parameters, and offered suggestions for them to reduce risks. Volunteering is just a wonderful thing. It makes me happy, and to make others happy or to be aware of things that they can do better for themselves is my goal. Love to do it, and that was an enjoyable event.
It was very heartwarming to be able to volunteer and help people that are interested in maintaining their health, and see how appreciative they were by waiting long times to have simple tests done, and the appreciation that they showed by having the opportunity to do this.
David Jansen, and I'm the laboratory director here at St. Mary's, and I'm also part of the mission formation Cohort 4 team. So I got up in the morning, and my initial thought was, you know, how can I get out of this? I've got so many things that I've got to get done, and you know, frankly, the Seahawks were playing later on in the afternoon, and I'd love to be home watching that. But I was committed, and so we rushed. My wife and I were both participating, and we rushed, got down there. And on the way, I started thinking about it as we were driving, and I started thinking, you know, I need to get an attitude adjustment, or it's going to be real obvious that I'm just going through the motions. And so I started thinking about it, thinking about what is it I'm doing here. And the thing that came to my mind was one of the statements that Mother Joseph had said to the sisters. It was one of her last words that she said to the sisters was, "Whatever concerns the poor is always our affair." And I thought, that's really why I work for Providence, and that's what it is I want to do. And when I got there, people were setting up. There was a lot of cheerfulness in the crowd. A lot of people were excited. People were already standing around waiting to go. Our piece of it was to do the cholesterol testing, my wife and I. And we knew that it was going to be a little slower and we were going to get a crowd, but we didn't anticipate the crowd that we were going to get at our booth. And it was a warm day and the crowd kept growing, and it was amazing to me how many people stood in line for this 8-minute test and how important it was to them. If I were going to a health fair because I have health benefits and I saw a long line, I probably would just walk on myself and not stand in that line. But this was obviously a need that they had. They were willing to stand in line for it. We engaged them in conversation. We explained the results to them, and they just seemed so thankful for this service. And by the end of the day, I realized, this was very meaningful. It was really important to them and to the community, and I was glad that I participated.
Hi, my name's Tom. I'm at the Facilities Department at St. Mary. The health fair just kind of reminds you how St. Mary reaches out to the public. When I started here 24 years ago, I was just looking for a job, but once I started and got into healthcare, I really got hooked. And St. Mary is like a family to me now. We have events like this, like a flu clinic, free shots for the public, and it really makes me feel like I'm part of a family. And the sisters rock. Thanks.
Hello, my name is Susan Leathers, and I help serve at the Community Health Fair with the stroke education booth for the Latino population, which has a much higher incidence of stroke than the general population. The Providence mission has long focused on serving the poor and the vulnerable. In fact, it was something that I heard about the very first day I ever came to work for Providence St. Mary's back in 1975. I met one of the sisters the first day, and that's the first thing that she told me, that we serve the poor and the vulnerable here. So here I am in the reflection garden, reflecting about my experience and just who are the poor and the vulnerable. Sometimes I think that we have to go out, and find these people, that they're out there somewhere, that they're out there somewhere else. But in reality, they're here all around us, our neighbors all along. So just across the street from here at St. Patrick's Church, what did I find when I thought I was there to serve? I found a people rich in spirit, a people rich in family. There were so many fathers and grandfathers with their family that Sunday. A people rich in patience. I heard not one complaint in the people waiting in line to get their blood checked on that hot day. A people with beautiful young girls and women dressed in their best for worship that day. I have to say, at my church, most of us wear jeans. So I love seeing everyone dressed up in their Sunday best. A people who reached out to help each other continuously. I don't speak Spanish, and so if I was having difficulty with somebody who didn't speak English, there was always somebody that stopped and helped us communicate together about the health instruction, education I was trying to give. A people who wanted to learn. At my booth, many people took both the English and the Spanish versions because they said they wanted to learn how to read it in English. A people who were vulnerable at times. When I asked a man for one of our fair passports, he misunderstood innocently, pulled out his wallet, and started to give me his legal immigrant paperwork. A people who wanted to be healthy. The highlight of my day was a middle-aged man who approached me and said in halting English, "God bless you. Thank you, St. Mary's, for trying to keep us well." At first, when we were planning to participate in this community health fair, I felt a little dismayed at the thought of it being on a Sunday, missing my usual church worship when I heard about this, because that's what helps me on my journey each week, revives me for the hard work we have to do during the week, keeps me in balance of perspective in the world and not lost in the minutiae of everyday life. But as the morning progressed, I realized I was in church, in fellowship with my co-workers and our neighbors, serving in the ministry of Christ, which is all about building relationships. There's a verse in Proverbs that says, "The generous soul will be made rich, and he who waters will also be watered himself." And I have to say, I was watered by my neighbors that day, helping at the community health fair.
Our foundress, Mother Emily Gamlin, was known as Mother of the Poor. We continue her mission of serving the poor and the vulnerable through our compassionate service. Providence St. Mary Medical Center Mission Leadership Formation Cohort 4 truly lived our mission that day, and I think they will keep this experience in their hearts forever.